Yo, it's your boy number 5. How's it going? Diaries of Doctor Number 5, episode 1. Let me tell you first of all, this is my professional look. Normally you'll have seen my stethoscope around my neck, but I've left it at work. So whenever I'm wearing this, I mean business in my professional outfit. Okay. Let me set the scene of this story. We're going back to Grimsby when I was working on the cardiology ward as a junior, and that's the place where people go when they have heart attacks and stuff. So in Grimsby, there wasn't many Asian patients that we had, but I distinctly remember this one Sikh gentleman who came in following a heart attack. He used to have a big, impressive beard and a very worried family. And I remember him being on our ward for about 3 weeks, and this story is dedicated to him and his family. So this Sikh gentleman I was telling you about, Mr. Singh we'll call him, he had a very big family, lot of kids who were constantly worrying about him, as you would, I guess. But he was actually quite chilled out. He'd had a heart attack, typical Sikh man, what are you gonna do, it is what it is. But his kids were constantly harrowing me about, what's going to happen to our dad, this, that, and the other. Anyway, one evening, I'd been chatting to them for a good half an hour, and the Sardaji looks at me. He could tell I was tired. He was like, "Son, what time do you go home, son?" I looked at the clock, and I didn't want to make him feel bad, because I'd already been there for a long time, past my normal regular hours. I was like, "Sir, I finish at 5:30. And he looked at the clock, he goes, "It's 5:30 now, son." And his kids were like, "Dad, it's 6:30. I actually finished at 4:30. So I guess the moral of that little story was that, all us NHS staff working in the hospital and outside, we know the deal. We know what it's like. You have a certain contracted hours, but all of them will work beyond those hours, and they're not going to get no benefit out of this. There's no overtime or incentives or bonuses like some of the rest of y'all. So if your patients or your friends or family of your patients, just keep that in mind, that we have friends and family that we need to go home to as well. Please let us go home. Thank God the Sardarji, Mr. Singh, had pity on me, and he said, at the end of the day, "You need to go home now, son. You look very tired." And I was like, "Sir, thank you very much. Have a good night. I'll see you in the morning." Anyway, that's it for episode number 1. Hope you all enjoyed. Diaries of Doctor Number 5. Peace.